Assalamu alaikum dear viewers, how are you? In this video we will discuss a false negative urine glucose. Now what is that? In some condition, for example in diabetes mellitus, diabetes Inspidus or glomerulonephritis, the glucose is leaking into the urine. But in some condition when you test that urine the result is negative. The urine have glucose but the test can't detect that glucose. Now this is the false negative glucose value. In some conditions, for example a urinary tract infection caused by E. coli in patient with diabetes or in kidney disease, so what happened, the E. coli hide the glucose in your urine. It hides the glucose from the test. The glucose is present in the urine but the test can't detect due to the E. coli which present in high amount in the urine. So this is actually a false negative result. Now suppose a patient come to you and he has glycosuria and you test it by the dipstick test, by the strip test. Now what happened? The glucose present in the urine, it is converted by the enzyme glucose oxidase into gluconolactone, because in the strip methods the glucose oxidase method is always present in the strips. Now the glucose converted into gluconolactone by the enzyme glucose oxidase and the hydrogen peroxide is released during this reaction. Now hydrogen peroxide is the main thing which is produced in this reaction, and when E. coli is present it inhibits that hydrogen peroxide. But in this case the hydrogen peroxide is convert chromogen colorless into the color chromogen, and we see many color in the strip test depend upon the glucose quantity, and we interpret positive, 2 positive, 3 positive and the 4 positive result. Now if UTI is present which is caused by the E. coli bacteria, the E. coli release catalase enzyme which inhibit the hydrogen peroxide, and the hydrogen peroxide cannot convert colorless chromogen into the colorful chromogen, and the test is false negative.